Hello friends, this is Dr. Bhavdeep Ahuja here. I hope you are liking my videos on my YouTube channel. So today's topic for the short video is that sometimes we come across patients who would want you to write something against a colleague, or a vice versa situation that sometimes you come across a bad work in the patient's mouth. You are in a dilemma whether you need to inform the patient and how to do that, because you would not be willing to own up the responsibility in future if any problem arises. So let's look at both of the scenarios. uh, in the first situation, if the patient walks into my practice and says, I know I have something bad in my mouth. So the thing is, you call the patient for the checkup, you check out, you see the case. It might be a botched up case, it might be a bad case, which or a good case, you don't know the history, but yes, the current condition is not very good. So you ask the patient, what is the thing that you want? If the patient says, I want the tooth to be corrected, my first take, again, I'm telling you my takes. My first take would be, we shall not discuss the past. That means whatever the earlier dentist has done, we will not be discussing why he did it, how he did it, why was the problem that happened. So we need to make sure that this does not this, and many times I don't even ask the name of the previous dentist. Then if the patient says, no, I know something wrong is there and I need you to write it down on your pad, or write it down on a piece of paper that yes, this has been wrong, then I politely say, I'm sorry sir, you are in the wrong place. Whatever it might be the situation, whatever might be the case, I believe very very strongly, एक डेंटिस्ट ही एक डेंटिस्ट का सबसे बड़ा सगा है. In actuality it might be different, we all bad mouth against each other, but then I am telling my viewpoint. एक डेंटिस्ट का सबसे बड़ा सगा है, better than the patient, even it might be a loyal patient. So the answers are very much clear to the patient, that if they want you to write something, they're not here for treatment. Try to smell a MLC or the medical legal case scenario from it. Obviously you won't be harmed, but then if you are writing against something your colleague, you might be in a soup later on, in spite of knowing. Again, that is a matter of ethical principles, whether you do it or not, but then I am suggesting what I do. Then in a different scenario, different situation, you need to understand that you come across a work which is a botched up scenario or a bad work. For example, a root canal has been done, the relationship between the dentist and the patient has gone sour, and the patient never wanted to continue with the treatment. So the patient comes to you, I have gotten the root canal done, I am not happy with the dentist, maybe his sanitization measures were not good, maybe sterilization didn't seem okay, maybe his clinic was not very clean, whatever the reason that the patient dropped the dentist and came to you for a crown. At this point of time, I always advise the colleagues, please go in for an x-ray. You need to understand that whether the root canal done, which doesn't belong to you, but once you place a crown, the root canal will become yours only. So make sure that you tell the patient if there is anything wrong that you see in the x-ray. Take the radiograph, please do take the radiograph and check it out if there is any issue, and inform the patient. If you can rectify it, obviously do that with the prior consent of the patient. At this point of time, many patients will say, मुझे उस क्लिनिक में दोबारा तो जाना नहीं है, जो करना है आप करो, ठीक करो आपको लगता है, बट मेक श्योर मेरे को पेन नहीं है, व्हाई डू यू वांट टू डू इट अगैन. Then explain the patient calmly what exactly is the situation. The patient, if the patient has a bad relationship with the dentist, he will not go back. He'll say, okay fine, I can pay you again, but do the needful again in that regard. Some patients will react that, अच्छा मैं उस डॉक्टर को जाके बोलता हूँ, मेरे को लिख के दो, मेरे को एक्सरे दो, क्या प्रॉब्लम है. Then you get in a soup. You can give the x-ray, but then don't give anything in return in this regard. It is going to create a bad blood between the two colleagues only. And just try to dissipate the scenario at your clinic itself. Try to journalize the things. Try to always say that this is a normal mistake which many people do. Even I might have done thousands of those cases. But at this point of time, I always say, if the patient is hell bent upon discussing the same or going back to the original dentist for a discussion or a talk or maybe a refund, uh, always try to inform the dentist after the patient leaves your practice. uh, as I always say, your relationship with your dentist is most important, and a new patient is not that important. Usually most of the cases, that patients will always believe that yes, we don't want to go over the past thing, we want to move on. So move on with the same thing and keep or make the note of the same in your records very very clearly. The third situation might be in a scenario that the patient says, मेरे को पेन नहीं है, आप कह रहे हो कुछ खराबी हुई हुई है, जब पेन होगा मैं तब करवा लूँगा. Again, get a consent done, mention this in the records that the root canal was not done properly by the previous dentist. The patient was told to get it repeated. The patient didn't opt for it. The patient has been informed of the consequences. So we are moving ahead with the crown part and the consent, and the patient should sign the consent very very clearly, and the consent should be accompanied by two witnesses as well. Two witnesses means one is can be your staff, and the one can be the patient accomplice, the patient's relative, neighbor, wife, whatever the patient wants to bring as a signing person. So a consent without four signatures is medico-legally less valid. Four signatures means the patient, the dentist, and two witnesses, independent witnesses. So I hope I make the point clear in such regards when we encounter such situations. So thank you so much for watching this video. Um, I hope you are liking my videos. There is a lot of webinars coming your way right from 2nd May onwards, every alternate day, and they'll be on the YouTube channel. And I'll be sharing the links, of course, in the various WhatsApp groups wherever I do so. Please do make sure that you attend them and watch them, because there are various topics which actually are virgin and have not been taken up in depth discussion previously. So thank you so much for watching this video. Take care, have a great day, bye bye, and I shall be back soon with another short video very shortly.